And welcome to Pregnant Possibilities. I am Jean Schumacher, and my partner is Dr. Deborah Shapiro. She is a board-certified OBGYN. And together, we created the program called the Pregnancy Advantage. And our objective is to help women to get their bodies pregnant ready before conception, or if you're having trouble conceiving, we can try to help you there, especially before you go down that rabbit hole in vitro fertilization. And we have some exciting news. We're currently working on the Baby Advantage, which will begin at conception and then take you through not the baby, but you through your first year. So today on our show, we're going to be discussing raising plant-based children and the impact that it has on their health. And today we have a very, very special guest, Dr. Joanna Frey from Back to the Garden in Puerto Rico, PR. And she and her husband run a supervised water fasting clinic in San Juan, certified by the International Association of Hygienic Physicians, and teach you how to regain your health through a whole food plant-based lifestyle. Joanna, thank you so much for taking the time to connect with us today.
Well, thank you so much for inviting me. It's my pleasure.
Thank you so much. This is so exciting. Honestly, I didn't know about the International Association of Hygienic Physicians, which is a professional association for licensed primary care physicians who specialize in therapeutic fasting supervision as an integral part of hygienic care. But I did spend time up at True North and follow Dr. Clapper around up there, and I believe that's where people like yourself get your training, right? Doing an externship. Because when I was there, can you explain something about your background and your training to do this before you started the Back to the Garden in Puerto Rico?
Sure. My husband and I went to school and did the Doctors of Chiropractic degree, and while we were doing that, we were presented with our nutrition teacher in our school was a hygienist itself, and he did water fasting. So imagine that we were getting from day one in our chiropractic studies information about this lifestyle and healthful eating and just in general, and water fasting as well. So immediately my husband and I clicked with the information, and we started learning everything we could from our teacher, from Professor Dr. Goldberg. And then when we graduated, we both went to True North because we knew that we needed to do a residency and get certified in order to do this modality in the way it should be done, which is in a safe environment, and so the patient could get the most benefits and we don't kill anybody. So we went there and we stayed in total about almost a year, my husband including, and then I went after. And it's an incredible experience. We were living in True North Center, and we were doing rounds daily, just being submerged in that environment. It's like a capsule. You're there all day long, and sometimes you have to take care of the patients at night because you're the intern. You're the one who has to wake up at 2 a.m. and run to the patient's room if they're having an emergency, and just experiencing all that process and taking the classes. It was just fascinating. And we left there and we knew we needed to open our center, and voila, here we are.
That place is really amazing. If anyone lives in the States and is interested, you can look up, it's called True North Health Center, and it's Dr. Goldhammer who runs it, and Dr. Clapper used to be there for a long time, but they always have other physicians as well, and lots of wonderful externs like yourself. A year, wow, that's amazing. I was only there for a couple of days, but I know you're there with the clients and the patients 24/7. It really is an incredible training experience for you. I don't want people to think though that there's a lot of emergencies, right? Because it's really not.
No. Yeah, when I mean emergencies, it's like, oh, I'm having an excruciating headache, or I'm having gastritis, acid reflux, or I'm feeling nauseous. Those are really the emergencies. People, they feel unconfident and they called one of the interns. But
on the other hand, we could also say that water-only fasting, which is what you do in your Back to the Garden, Puerto Rico, just like at True North, that is not something that we think people should just undertake at home.
It just sounds a little daunting, just the idea of doing it on your own. I mean, and nobody checking on you and just checking your vitals, maybe checking your labs weekly to know how your electrolyte levels are. And if you have conditions or comorbidities, you really should undertake such a process without the guidance of somebody that really understands the process, not just anybody out there that you saw on social media, somebody that's actually certified by the association, that's been has done the residency, they understand what they're doing, and they can actually help you achieve health instead of get into get detrimental effects from the whole process and have a bad experience, because it's truly an amazing experience clinically, but also spiritually. And it's very sad when I hear people telling me, Doctora, I did my fast and it was horrible and I almost died. And it was like, wait. I know this person was doing it on their own. They didn't have any guidance. They didn't even know if they could be a good candidate. And it's very sad because they're losing so much that they could be gaining. So absolutely.
That's very important. Thank you, Dr. Frey. Thank you. Thank you. Well, can you share with us your plant-based journey? You talked about how you were introduced by this Dr. Goldberg in your training, in your medical training, chiropractic training. But were you interested in plant-based nutrition or even in eating vegetarian or vegan as you were growing up? And you grew up in Puerto Rico, right? Until you went off to school.
Absolutely. I grew up in Puerto Rico, and when I was 19 years old, which was like almost 20 years ago, I met a medical doctor here in Puerto Rico that was very into Ayurvedic medicine, but he was very special in the fact that it's not the Ayurvedic medicine we hear about usually in social media and online. He was more tuned with healthy lifestyle factors. And inside of that, he promoted what now is called the whole food plant-based diet, which was a high starch diet based on the local foods from Puerto Rico, which is a lot of root vegetables and grains and legumes and very low in fat. But he always marking excessively the importance of sleeping well, growing your foods, getting outside in nature, exercise moderately, and having a community. So when I joined this community, I learned about those pillars of health, and it was immediate click. I knew because I saw the effects in my body, and my family joined in, and we were all doing it together. Then I went traveling, and I went to study abroad in Europe and the States, and I lost connection of the other healthy pillars. I kept the eating habits like 80%, but I was doing recreational drugs. I was drinking, I was partying, I was having fun. And I saw how my health was decaying, but it wasn't enough to be like an alert and a stop in my life. So eventually over the years, I ended up in Georgia, and I met a hygienist there. And I went back into the lifestyle, and my health recovered immensely. And I knew I needed to start right away this journey, but I wasn't ready to commit to schooling. So I started doing like Pilates certification and yoga certification and cooking certification. And I started doing all those teachings in Georgia. And then suddenly I was like, I'm ready to commit. I need to look for a serious program that I can really connect this information with science, because I wasn't reading research. I wasn't connecting to the anatomy very finely. You learn about anatomy in yoga and Pilates, but not specific, not so detailed. So I was looking for different programs, and I finally chose a chiropractic. That's why later, I don't adjust. I went there for the science, for the information, and to expand my knowledge in what I did without having to learn about medications or remedies. I was like, no. I don't want anything to do with pills, because I already had a clear understanding about health. So I went to a program that I learned more about anatomy and physiology at most, and then maybe a little bit about some kind of therapy. And chiropractic was the best one out there. And I joined the program, I did it, and I met that nutrition professor, which was aligned with the same teachings, with this incredible, because in any doctoral degree, you will never find a nutrition class like that. And we have nutrition there almost every trimester. So there's a lot of nutrition classes versus the medical doctors and naturopathic degrees. So I got to be submerged in that lifestyle and ended up in True North. And it's been years now I've been practicing this lifestyle, and I can't say I could ever go back. No way.
That's fantastic. And you met your husband
we had a baby there at school, and then we have another one right now. So
fantastic. Congratulations. So when did you create Back to the Garden, and when was that conceived in your head?
Well, it's been conceived since our doctor's degree, but in physical form, when we moved to Puerto Rico, which was 5 years ago, we opened our clinic, and then eventually we open our center. So right now we run through 2 different ways. We have a clinic in the center of the city, and then we have as a residential center in the countryside in the suburbs with a 5-acre farm. We've been working in this for 5 years, and it's been a very transformational experience. So it's really exciting.
And you farm, you grow you grow some food.
Absolutely. We're growing. We have around 50 different varieties of fruit trees that are still, and they're still growing. We have tons of coconut palms with coconuts. We have banana trees and plantain trees and breadfruit trees. And we're starting our new phase of growing greens and herbs and roots. And that's starting. There's a lot of work in this farm to do. And our focus is mainly on our patients and the education. We have a rigorous education program, not rigorous, but we're very obsessed with educating our patients. I do a lot of social media content, and it's a lot of stuff to do.
Fantastic. Can you tell our listeners about any of your experiences that kind of stand out in your head about using water-only fasting to reverse a chronic disease? It can come from your experience at Back to the Garden, and also or from your time at True North. I don't think people really understand necessarily what's possible.
Well, water fasting and that clinical area, I think you guys have interviewed Dr. Goldhammer and Dr. Gershfield. I'm sure you've heard about it. Well, maybe not everybody that's watching, but clinical fasting, it's a great tool to set yourself in an environment where where you stop doing things. You're in complete rest, and you're not putting anything inside your body except water, and you're being monitored. So you're in a very safe environment, but you're also resting fully throughout the whole day, which is something that we don't practice anymore in our community, in our society. We live in a society that promotes overachieving, overdoing, sympathetic behavior, constantly fight and flight. So when you try to relax, it's almost like you're being lazy or mediocre. So, we have an inverse relationship with health. And here in Back to the Garden, you are in complete rest. So you let all that energy your body has that is not directed to digestion or other activities to be directed to detoxification process. And of course, you're going to see reduced inflammation and reduced oxidative stress, and you generate your cells and your neurons also as well. And many other clinical factors occur, which lets your body start the process of reversing. And we've had many cases here. And I mean, the diabetes type 2 and autoimmune diseases and cancer patients. And we've also have cardiovascular disease patients, and they've done great. There's a specific one. We recently published a case study in the International Journal of Reversal and Prevention of Disease Prevention and Reversal of a reversal case of psoriatic arthritis. And it was a 10-day fast with a 4-day refeeding. And this patient came here with fissures in her hands and plaques in her extremities. It's a very painful, uncomfortable condition. And she was under many medications. And once we took her out of all her medications, she started the program, and she reversed completely her condition. And 4 months after, we do checkups on her, and she's still doing great. She's adhering to the lifestyle, which you need to do, because I always tell our patients, if you're coming here to get cured, you're stepping on in the wrong way. You need to understand this is a piece of the puzzle that you have to do, and will facilitate health to start in a very profound way. And then you need to continue the work at home. So yeah, that case study was just published recently, and it's very interesting. So you guys can check it out. I have it in my page and backtothegardenpr.com.
Fantastic. That is a wonderful journal too, that just started probably a couple of years ago, right?
Yes.
That's really fantastic.
Yes.
Oh, that's amazing. That's wonderful. That's wonderful. And I know from Dr. Clapper that at True North, they had actually a reversal of a lymphoma. You probably heard about that. But just to be clear, you're not recommending that people with cancer sort of come to you as an alternative treatment for cancer, right? Just
most of our patients come here as an adjunct therapy to their chemotherapy. We've had some patients that don't want to do chemotherapy, and they want just to come and water fast, and we've had great results on that. But these are very well analyzed cases. It's not just random people coming here. We do, you get screened before you come to the clinic. So we don't take anybody. We make sure that's a patient that is a good candidate and that might have fantastic results, wonderful results from their experience here.
Fantastic. That's great. Thank you, Dr. Frey. Thank you so much.
Dr. Frey, I know you've got an older child, but then you just gave birth to, so congratulations on that. And, we'd love to see some baby pictures if you have some, or if you have the baby handy right there.
He's sleeping, but you can see a little bit of him.
Okay.
He's really chubby. He's 3 months old. He's 15 pounds. He weighs so much. I can't even hold him. We'll see him, and you'll see Dr. Fry. He's carrying him in the kangaroo, in the ergo carrier.
Aww.
We have this is my older child. He's here. I just have to show him because he wants to come in camera.
Okay.
This is Asher.
And what's his name?
Asher.
Asher. Hi, Asher.
Hi, Asher.
And what is Asher munching on? What do you got there?
He's got some oats and carrot scones without flour that I just made this morning from one of our ebooks.
Ooh. And he looks like he is diving into that without question. No doubt. Thank you for sharing that, your family with us. So did you find it, easy eating a whole food plant-based diet throughout your pregnancy and breastfeeding? Were there any challenges for you?
Not really, because I already had started this lifestyle way beyond. I had my first child and my second child. So I already had set up a clean departure road before I was pregnant. I was home. I really was a master of my pillars of health, my sleeping early, not doing recreational drugs, eating healthy, being outside. We were both doing that. That was our priority. So when we got pregnant, it was wonderful because I did not have much of the symptoms that many people have during their pregnancy. So yeah.
Well, how was your birth? Was it tricky to find a responsive doc or a midwife where you live? I mean, did you have hospital birth? Did it go the way you imagined and planned?
No, it was not as I imagined. My first birth, I hired a midwife, and I was in Georgia. And I also hired a nurse midwife just in case, and a doula, and I was all about having that, what do you call that word? It's like ecstatic ecstasy of birth that those females speak about. And I didn't really have that experience on my first birth because I wouldn't dilate. So the midwife said, we really need to go to the hospital. But I had a nurse midwife, so it wasn't a birthing center. So my experience wasn't as cold and sterile as it usually is in the hospital experience. With my second birth, of course, I was like, this is going to be a natural birth. I'm going to be in my home everything's going to go the way I had imagined it. I meditated on that and everything. And then in Puerto Rico, it's not hard to find midwives. We have many midwives and many obstetricians that back up for them. Not many, but we have a few. But I chose a midwife towards the middle of my pregnancy. And I thought she really had the experience. I didn't have anybody refer her. I just looked her up and I thought this is going to be a good match. And by my 42nd week, I wasn't dilating or having any contractions. And she kind of showed us that she really didn't have the experience to deal with that kind of situation, which was really sad because then other midwives that I spoke to later have managed successfully. So anyways, I had to end up in a hospital setting. And what I make sure in the hospital is to put the rules down with the staff, making them know that I really want to have a natural birth as much as I could. And I did push my son out. And he latched immediately. He wasn't cleaned out at all. And it was as natural as I could have inside a hospital setting. And I say that because you have the lights and you have the coldness of the staff typically, there's a lot of protocols. It's not very individualized and you have to deal with that. But I was able to have my baby and I brought it home and that's really the reality of my story.
I'm really happy. At least you got to have vaginal deliveries. That's really wonderful. And right?
Yes.
Yeah.
Well, we went there very educated and we knew and they respected that, and I feel bad for some moms because they go there and they don't have a lot of education on the topics and then they just go there and they do whatever they tell them and they might believe whatever it is. And that is really important. You should get educated before you give birth so you're prepared for any environment and you can have the best experience in any of those.
I think that's one of the things that we really try to do in the Pregnancy Advantage is we want to educate our mamas before you're thinking about having a baby. We want them to get this information understood and then to plan, to what you want to do, your experience, but know that things can go wrong and change and happen, and you have to sometimes roll with the flow, but also letting people know ahead of time what your choices are and what you want is so mission critical.
When we went to the hospital, we were receiving like, we're gonna have to do this procedure and this, and then both of us got together and told them, this is what we want to do. We know we are educated people about this sort of situation, and everything changed immediately. They looked at us differently, they respected what we were saying, and they really did their best to accommodate of what we wanted. And so I can't really, it wasn't what I was expecting, but I can't really say it was a terrible situation either.
So you went to 42 weeks and you were not going into labor. Did you just need some cervical ripening or some Pitocin? What did they do for you? I'm sure they didn't just give, what did they do for you at the hospital that you weren't having at home?
When I got to the hospital, the contractions started, but they were really low and I wasn't really dilating. So they put, I forgot the name of the pill. There's a pill that they put.
Misoprostol.
Right. So they put that over there. We did that. We did half a dose. And I just waited like 10 hours, and they wanted to accelerate the birth, obviously, but we stayed there. We waited until we were ready. We didn't want to do any more doses. And then the moment came. It was traumatizing because when you're induced, no matter how low your dose is, you're going to get levels of contractions that are abnormal, I believe. And so, I had the support around me. Because when you're in that situation, you want any way out. You want C-sections, you want more drugs, because the contractions are just so severe, the pain behind them. So, but I was able to push my baby, and that's really all that I wanted.
Fantastic. I'm glad. I'm so glad. Did you by any chance start doing dates early on, like at 37 weeks? Did you start eating dates?
Oh, I eat dates every day.
Wow.
So that's no. We have a lot of dates. We sweeten everything with dates in our house, so they're part of our.
All right, because there was some data from Iran that said that eating dates starting a term would help to ripen the cervix and prevent an induction, but obviously not 100%, not for everybody. But so thank you for sharing that. I know that's sort of intimate details about your birth experience, but I think it's good for people to hear that even when people are professionals and they're doing everything right, sometimes things don't go as planned in the delivery room, and it is important to have a birth plan, but also like Jean said, to go with the flow, because we can't control everything. And you're lucky that your baby, even though you were 42 plus weeks, your placenta was strong and its blood supply was fantastic, and you were able to oxygenate the baby properly through all of that, and so it was because of that the people, the doctors and nurses felt that it was safe to go on, right? Because there was never any issue about the baby not getting enough oxygen, and that doesn't always happen when you're post dates. So you're very lucky too. Yes. And maybe that's one of the benefits of being plant-based even from before you get pregnant, right? To have that really excellent connection between the placenta and its blood supply. So can you talk about what you would say would be the benefits for women to go plant-based before they get pregnant?
Absolutely. I get this question a lot from our followers. They ask me, why should I start changing my diet before I get pregnant? And I always tell them three main tips. Number one, you are able to achieve your ideal weight. We have a serious problem. I know we've heard about this, and now the CDC just announced that 42% of our population is obese. So we know that being in our ideal weight without over fat, because we can be in our ideal weight and have excess adipose tissue, which is not healthy, but being on our ideal weight is abnormal. So sometimes we compare ourselves. I have patients that come in here that are overweight, and they said, the only thing I'm not happy about the fast is that I'm going to lose weight and I don't want to lose any more weight. I'm like, you are overweight right now. You know, we compare ourselves with others. So this is the moment to get your ideal weight, because when you're overweight or obese, you're a high risk for numerous amounts of diseases, most of them from dietary excess. So we're talking cancers and diabetes type 2 and autoimmune conditions and heart conditions and gastrointestinal disorders and more. So you start reducing your risk for all these chronic diseases that are killing our population more or less. Also, you're setting up your body to be healthier, obviously, and that you can actually reduce all that fat that we are conserving, and that it's just very dangerous. We know fat in our body acts like a hormone, and it just produces a lot of secondary detrimental effects. So number one, you can start working on getting that ideal weight that you need to have a healthy pregnancy. Number two, I always tell my patients that you're gonna pave that road to master a healthy lifestyle. Changing to a whole food plant-based diet or changing to healthy lifestyle factors is not as easy and trendy as it sounds. It really can be very challenging because there's a lot of food addictions and learned behaviors that really pull us back, you know, to being healthy. You know, we have a lot of baggage, and sometimes our social environment doesn't approve of it. So we have a lot of obstacles. So when you start, before you get pregnant, to hone down those healthy factors, and I'm speaking not about only eating healthy, because now we talk about plant-based diet, but what does that even mean already? Like my husband was saying, plant-based diet doesn't mean anything anymore, unfortunately. Every doctor, including plant-based doctors and including leaders in the plant-based doctors world, have their own subjective opinion of what a plant-based diet is. Some of them include oils, and some of them include foods high in sodium, and high-fat diets inside the whole food plant-based diet. So the definition is very confused. So we need to understand what a real whole foods diet is and start practicing that, getting really good at it, and then getting all those other pillars of health mastered down. So when you start being pregnant, it's up the road. And I think we all know that when you're pregnant, you are in a position where everybody advocates for you and supports you to practice unhealthy habits, especially eating. Oh, go ahead and eat this. Oh, you're pregnant. I brought you some cake. Totally. Like it's everybody wants you to be overweight and because you're pregnant and they don't even know what they're doing. So we need to have our mind clear and educated and know how to handle those situations. Some people are scared of saying no. Just don't learn before you get pregnant how to handle that. So when you're pregnant, it's just easy and you know how to deal with those uncomfortable social situations that come abroad.
I mean, I think as a mom, we tend to start comparing our children to other children, you know, along the way. And, you know, how is he doing compared to other children in terms of his health, in terms of his vitality, energy?
Oh, my son, both of them are in great shape. And what really, and it hasn't been challenging because I started this lifestyle before I got pregnant, is the social activities of children in school specifically. Because when they go to school or they bring their lunches, he goes to private school, so there's no, what do you call that in English? Everybody goes to the same place to eat.
The cafeteria.
Cafeteria. You have to bring your lunch. There are cafeterias, but it's mostly what you bring to school. So I've always been training him since 2 years old. When he started 3 years old, he started preschool. He brought his food. I always spoke to the staff and he told them about the lifestyle he lives. If they were doing an activity, I made sure to bring something similar to what they were having in the party so he didn't feel left out. And let me tell you, it was more about me and the way thinking that he was going to feel bad, but kids don't really care at that age. He doesn't really, it's not important. They care about playing and having fun. And when they will go to the table and you see that they're going to go to something unhealthy, you just remind them, listen, I have this, I brought this. You remember the snack that you liked, and you educate them. I've been educating my son since he's been able to listen and understand me, especially always connect. It's easier to connect not with how healthy something is, unhealthy, but animals, the ethical part, the environment. They can connect with that easier. So it's been really easy. My third one is that when you start being a healthy individual before you get pregnant, when you get pregnant, you actually get to enjoy your pregnancy. I'm going to tell you something. Most females, when they get pregnant, they have a really hard time. At the beginning of their pregnancy, they get morning sickness, which is a way of the body rejecting those unhealthy foods because our body's incredible and has all those tools for us to handle. And then, or nauseous or constipated throughout the whole pregnancy, hemorrhoids, radiculopathies like sciatica, back pain, etc., miscarriages, developmental issues on the baby, and so forth. And when you're pregnant, it does not have to be like that at all. And I'm going to be very honest. I have 2 children, and I've had wonderful pregnancies. Of course, when you're in the 3rd trimester, it's heavier and you're a little more fatigued. But I slept fantastic throughout my whole pregnancy. I always, I was practicing a healthy lifestyle. I was getting adjusted. I was getting massages as well. And I was feeling energetic. And that glow, that pregnancy glow that people talk about, you really portrayed it from inside out because your face is actually well defined. You're not swollen. I actually never had to take my marriage ring throughout my both pregnancies. So you get to really connect with your inner self because there's something special about being pregnant. You're creating a human being. So you have a lot of internal factors that are taking you to go inside of you, to take more care of yourself, to listen, to be more in tune. And when you have a healthy pregnancy, you can actually connect with that inner self, enjoy what's happening around you, make better decisions. So really, it's worth to those 3 benefits. It's all worth it.
So well put. That was amazing. That was amazing, Dr. Frey. Amazing. Thank you for that, because that's exactly what we talk about with the Pregnancy Advantage. Exactly. Fantastic. Couldn't have said it any better. Amazing. You're amazing.
It's what we're trying to push, and we want people to experience this. And it's, it's relatively new for people to understand how that you can enjoy and have a wonderful pregnancy. So thank you so much. Just next week, we're going to be back at our same time, Thursdays at 12 o'clock. And we've got Dr. Christina Miller back again. So Dr. Frey, thank you so much for taking time from your, I know, very busy day to join with us today.
Absolutely. Thank you so much for inviting me.